A lot of folks in the room have not seen one another yet this year, and I've not seen many of you yet. So Happy New Year and welcome to the January First Friday Means Business. We got a great program for you this morning. So let's return thanks for our meal this morning, and we will get started. If you would bow with me. Father, we thank you so much for just a beautiful new day of life that you've given us today, Lord, and an opportunity to serve you. And I pray today that you fill our cups, Lord, to overflowing, that we wouldn't miss one opportunity to do just that, to bring glory to you in all of our efforts. And we thank you, Lord, for the meal that's been provided this morning. Ask that you bless it to the nourishment of our bodies and our bodies to your service. In Christ's name, amen. Amen. With that, it is my pleasure to introduce to you our 2022 board chair, Mr. Billy Frost.
Yeah, wow, 2022. Welcome to the First Friday Chamber Breakfast. Large crowd. Heath told me probably nobody would show up today for my first meeting, so yeah, he missed that a little bit. But Heath gave me 3 rules for the incoming chair. He told me don't embarrass Heath Taylor. And rule 2 and 3 is the same rule. So, before I introduce the speakers, I thought I'd go ahead and try to do something new for him. January 7th, 1972. I Googled 100 years ago, and there's not much information on the internet for 100 years ago. But today, on Friday, January 7th, 72, Richard Nixon announced he would run for re-election. Thought that was interesting. The Los Angeles Lakers won their 33rd consecutive game, 44-point victory over the Hawks. Then for the bankers in the room, this was really interesting. Police located and defused time bombs that had been placed in safety deposit boxes in 8 banks in New York, Chicago, and San Francisco that were placed in 1971. Thought that was pretty cool information. Not to scare the bankers. Thank you, Josh. Next with county talk is Trey Kemp.
I know I've talked probably briefly about some of the things that are going on in Lawrence County that are the most pressing things for commissioners. The thing that we have been debating the most recently has probably been all of the trash on the roadways and things of that nature. We get calls about it. I know I get calls about it every single day. It's one of those things that's almost impossible to enforce. So we're trying to hit something that will make it so that there's a tangible impact to the trash on the roadways for everyone in Lawrence County. And our target right now is dilapidated structures. The city has placed a blighted ordinance into effect, and they've been using it for, I guess, 2 or 3 years now. And so we're trying to do something like that on a much smaller scale. Half demolished structures or half standing structures are fixing to become a target of Lawrence County trash enforcement. And that this is not to unduly burden people who have farmland or tracts of land and there's old farmhouses on there. That's not the target of the commissioners. We're looking for properties that are barely hanging on. So if a strong wind comes along, they're just going to become one big, huge pile of trash. Or there's a huge pile of trash that totally surrounds the property now. And so we're working on ways that we can enforce that equitably and so that we can be fair to everybody, but at the same time clean up as much of Lawrence County as we possibly can. I bring it up to this room because there's a lot of really smart people in here. A lot of folks are a lot smarter than I am for sure. So if you guys have any good ideas about the best way that we might enact this, please feel free to contact one of your commissioners. If you don't know who your commissioner is, contact me. And we're going to be debating this for the next 2 or 3 months until we take final action. So if you have some genius idea, please give me a call and I'll do whatever we can to pass it to the group and make some positive things happen. Y'all have a good one.
The City of Dublin Natural Gas provides the most cost-efficient source of energy available today. So for your home, choose the most natural resource. Safe, clean, efficient. All new subdivisions around the Dublin area have natural gas available. Start reducing your energy bills today with Dublin City Natural Gas Department. Natural gas, the smart choice. Call 277-5048 today and let us help you start saving today.
Happy New Year from Dublin Chevy Nissan, your destination for your new or classic car needs. Whether it's a Rogue, Yukon, or Silverado, we have the best selection in Middle Georgia. Whether you're online or in person, you can choose with confidence from our wide selection of local pre-owned vehicles. If you're looking for fuel economy, we have a great selection of new Nissans and GMs to choose from. And new for 22, Don sells trucks well, only at Dublin Chevy Nissan.
All right, so now it is my privilege to announce some speakers this morning. With City Talk, help me welcome Josh Powell.
Thank you, Billy, and good morning, everybody. My name is Josh Powell, as you said, and I'm the interim city manager, given Lance Jones' retirement of late. And before that, I was city attorney for Dublin for 6 years. And if you knew that, it's probably because you got a speeding ticket somewhere in town and called and wanted a favor, or you had Phil Best call and ask for a favor. But I'm excited to be filling this new role. We had our first council meeting of the year last night, and it went very well. The newly elected council people were sworn in. As you know, Mayor Kite was sworn in back in November. But Tess Godfrey was not able to be there. She is in quarantine right now, but we'll get her sworn in just as soon as possible. And but just look forward to doing some good work with the city until this position is permanently filled. And I look forward to working with each of you to make the city better. If you need anything from the city, just please reach out to me and let me know. Thank you.
Next is David McLeod with Optical Business Manager at Eyesight Associates.
Being a Baptist preacher, I'm going to do something that I never attempted to do before, and that is make a 2-minute presentation. I promise to only close one time. We at Eyesight Associates, we're excited to partner with the Dublin Lawrence County Chamber of Commerce to provide members with a comprehensive eye care benefit. This benefit is no cost to you all. It'll be included in your chamber membership. You pay that, you're automatically covered. We're looking forward to not only providing second-to-none eye care, but also growing with your businesses. This gives you, your employees, and their family member a great benefit by just being with them. If you have any questions, I'll be glad to meet with you collectively or individually after the breakfast, or we can schedule a time that we can meet and go into more details. I do have some handouts after breakfast if you want to receive a few of those. And once again, as I close, thank you for this invitation and the opportunity to speak with you.
Okay, next is Sponsor Talk with Jennifer Bryant, our sponsor for the morning.
I know everyone is excited for the upcoming program, so I'll make this short and sweet. We appreciate everyone coming out to January's First Friday Means Business, and we appreciate the opportunity to sponsor it and come alongside our community for events such as this. We are excited to see what 2022 holds and how we can continue to foster our relationships and our partnerships for the upcoming year. So thank you so much for allowing us to be here today.
It's nothing personal. It's just business.
Hello?
That's how some people do things.
Right away.
To us, everything we do is personal. Because anyone can answer the call. It's who shows up that matters most. That's the quality of your independent agent and the company that stands behind them.
Ask Curry Maffett Insurance in Dublin if auto owners make sense for you.
My name is Phil Patel. I am one of the part owners here and the general manager here at the Hampton Inn & Suites. First time when I got introduced to Morris Bank, the people were so friendly and helpful. You feel like that you are appreciated there. At Morris Bank, everybody down at the bank is so friendly, and not just to myself, they're just friendly to everybody. They want us to succeed because our success is their success at the same time. That makes a lot of difference, and they're always there for us.
Next, it's my pleasure to present our speaker this morning, which needs no introduction, but Dr. Thomas Kraft. He is the District Health Director for the South Central Health District.
Good morning to everybody, and I guess in light of what I'm going to talk about today, I'll say just thanks for having me back. I know that COVID is not everybody's most favorite issue, but I was asked today to kind of give a health update, which will include some COVID update, but it's good to see everybody here, and I'll try to provide as much information as I can and then open up for a few questions at the end. Again, part of a health update this day and time can't help but include a COVID update. I jokingly sometimes refer to it now as the Greek alphabet update because, anyway, everything's named after a Greek alphabet letter. Hopefully we're going to not run out of letters before this thing is over. Just real quickly to kind of remind you where we were the last time I spoke, which was October of 2020. We were just at the beginning of the pandemic, or early part of the pandemic, and we were really scared by numbers of 3 and 12 and 17, and especially when we hit 57 cases in a whole week, we were all terrified and probably didn't really understand what we were up against. And that correlated with a state epi curve that looked somewhat like this, where we started out with nothing, and in March kind of began to have the uptick, or what we thought was our first wave. Really, this was just introduction of disease into the area. But if you move forward to now, this thing is actually going crazy. Sorry about that. If you move forward to now, the graph that we see from before was just this little ditzel here. And now over the course of the last 2 years, we've had a first wave or alpha wave. We had a second wave, which they didn't really call anything but a second wave. This wave is the Delta wave, and you can see each time how they got a little bigger, maybe a little more rapid and upslope. And then this is now, which is our current Omicron wave that started back right about Christmas time. And two things to notice. Number one is how almost vertical the acceleration of cases is in the state of Georgia. It correlates with what we've seen in the country. Whereas it took 3 and 4 weeks to go up before, sometimes even 6 weeks in this wave to get to the top of the curve in a week to 2 weeks time in our state, we're still accelerating and anticipating quite a bit of more documented disease. Just to give you an idea of what things are looking like in our country, nationally, COVID cases are on the rise again in all 50 states in the United States due to the Omicron variant. And we're showing increasing rates of transmission all across the country. If you look at the color or the deepness of the red color, that shows you where the most disease is. And of course, this being our home state of Georgia, shows you we're in the mix of some of the worst increasing rates at this time. You'll also notice that we're kind of about here in a lighter orange area, which means we're about 2 weeks in the surge behind the Atlanta and metro area, and still have higher disease rates to see, higher case rates to see, but they're coming fast. Again, this is kind of some just current case rate information from our area. These numbers represent kind of the up and down slope of the last Delta wave, where we got up to a high of about 951 cases in Lawrence County in a 14-day period. So we were almost 1,000 cases in 2 weeks at the height of the Delta peak. This is our December-January data. We had kind of the November lull where we were only having 30 to 40 cases a week for several weeks. I didn't realize till last night when I was putting this slide together, there's actually a 2-week gap here where my folks taking Christmas vacations and New Year's vacations didn't plug this in. But between this 50 cases and this 633 cases, which was last week's data, there was a 91 and a 150, and then a sudden surge to 633, and we're rapidly accelerating locally with our case rate. And then I just threw in, I know this is Dublin-Lawrence County, but we're all affected by the surrounding area. I serve a 10-county area, so I usually have those data available as well. And again, the thing that you see there is the same thing on a 10-county basis. A good little lull and then a jump to almost 1,200 cases in a 14-day period last week. So we're rapidly accelerating from a nice respite that unfortunately only lasted about 4 to 5 weeks. And then this is just to kind of give you a daily perspective, and this is a daily report that I get from my team every day that tells us about the cases the day before. So I don't have yesterday's cases because I'll get them this morning when I get to the office. So this is really from 2 days ago. But you'll see that on the 5th, Lawrence County reported 99 new cases in one day. So at that rate, you can tell we'll easily accelerate well beyond what we saw with the Delta wave, which was quite significant. And in one day in my 10-county area, 275 cases. So hold on to your hats. More importantly, hold on to your masks, and just try to continue to do the things that we've been doing all along to prevent getting the disease and spreading the disease. Again, to kind of compare where we were when I came last, which was October of 2020, our area, 10-county area, had only reported 5,900 cases at that time and 266 deaths. And for Lawrence County, we had reported about 1,900 to 2,000 cases total, with 89 deaths back in October of 2020. Comparing that to now, where we've progressed through this whole pandemic thus far, we're now at 27,000 total cases in our 10-county area, with 884 deaths in the 10-county area. And then specifically with Lawrence, we've passed the 10,000 case mark when you add confirmed cases and presumptive cases together. And again, that's just numbers that are additive of PCR cases and antigen tested cases. But we've now passed over 10,000 cases in Lawrence County, and our deaths at the end of my last weekly report were 257 in our county alone from COVID-19. And then again, these are just the 10-county area totals that correlated with what I told you just a second ago. To kind of project what we might see, I was kind of asked to give some thoughts or some projections. I just brought two things to kind of share with you. On January 4th, New York Times came out with an article that was talking about different case rates in different areas of the country, but it said in Georgia, new COVID-19 cases have risen 704% in the last 7 days, with 25,000 cases on Christmas Day reported. And we're pretty consistently now as a state reporting about 23,000 to 25,000 cases a day. In large part coming from the metro area, but again now over the last 2 weeks trickling heavily into the southern part of the state. Mayo Clinic also did a projection model that predicted that Georgia could see more than 40,000 new cases of COVID-19 daily over the next couple of weeks, and that was reported about the same time. So those are significant numbers and have significant implications for the whole state. Real early in this thing, when I knew nothing, I really figured that we would be protected by our ruralness, and we are to some degree, but especially with this particular Omicron variant that's been so incredibly infectious, it's rolling through like a tidal wave when it comes. So hold on to your hat. It's here. We're probably still on the uptick and have in our state probably an estimated January 15th peak of cases, and then maybe we'll begin to come back down after that. So what can you do? At this stage of the game, everybody's like, this has been going on for 2.5 years. What can you do? It seems like no matter what we do, we still know of people who get it. But there's really nothing tremendously new that you can do on an individual basis other than just be real vigilant about doing the things that we're supposed to do that we've heard about for 2.5 years. And currently, in this current peak, I'd like to encourage people to still do those same things. Be aware of your symptoms. In a peak of a pandemic or a peak of a wave like we're in now, there's a lot of individual responsibility on being aware of your own health, your own symptoms. And symptoms really is as minimal as a new runny nose or a heavily runny nose that's a little bit more than your usual, get up and blow your nose a couple of times in the morning kind of thing. Really simple symptoms can be mild COVID, so be aware of that. If you're suspicious at all, try to stay out of your work environment or do whatever your policies are to be aware of how to respond to that. And we encourage testing. We're still trying to do some drive-through testing Monday through Friday here, and testing's available as well through urgent cares and primary care physicians. So be aware of symptoms, and then of course, based on symptomatology, we strongly encourage you to follow CDC guidance, which is changing rapidly right now, and I understand that that's sometimes hard to keep up with. But I encourage people, especially those in leadership, to try to stay as current as you can with CDC's guidance, and be aware of how it implicates how people should respond in your work area and that sort of thing. And of course, the other thing that you can do is vaccinate, vaccinate, vaccinate. And I wouldn't be a public health employee if I didn't encourage that. But to date, that's still the major thing that you can do that prevents both disease rates, or it decreases disease rates. But the important thing that it does is dramatically decrease severe disease and hospitalizations and deaths. We know no vaccine is 100% efficacious. Measles vaccines aren't 100% efficacious. None of those are, but they dramatically decrease disease, and in some cases they've eradicated disease. That takes time and persistence. But again, vaccinate, vaccinate, vaccinate. And then of course there are other things that you can do as well if you contract disease. I just wanted to mention these briefly. One is monoclonal antibodies. And I wanted to mention particularly with the Omicron variant that the older monoclonal antibodies don't seem as effective against Omicron, and those are still out there and need to be used until we have adequate amounts of the newer products. But those are infusions that give your body antibodies to fight with if you develop significant disease. Everybody doesn't need them. Your hospitals and your primary care physicians and those sorts of folks will kind of help determine who's sick enough and who needs monoclonal antibodies. But I did want to mention too that there's a new monoclonal antibody coming out. I don't know a brand name, but the generic name is Sotrovimab. It's more effective against Omicron, but in short supply currently. I think it was last week sometime that our whole state only got 800 doses as an allocation from the federal government because it's so new. But those supplies are increasing, and our supplies will continue to increase in this area. And then lastly, I wanted to mention, not by brand name or anything along those lines, but there are also oral antivirals for COVID-19 that are available now too, newly approved by the FDA and more on the way. But they're being federally supplied right now to federal partner pharmacies, Walmart, Walgreens, and we don't have them, but Good Neighbor pharmacies across the country. They are also on limited supply, but rapidly being increased. And again, to get a prescribed medicine, of course, you'd have to see your physician, and they can be prescribed through a primary care physician or urgent care physician as an early oral medication to greatly decrease the amount of disease you would deal with. And then again, a last step effort is hospitalization for the very sick and the at-risk populations. Everybody with COVID doesn't need to be in the hospital, and luckily that's the case. And Don, hopefully you're seeing what we're seeing statewide and nationwide, that with this particular Omicron variant, hospitalizations aren't quite as high yet as they were, but they are seemingly not as severe is the most important thing. We're seeing fewer people ventilated and fewer people with really prolonged hospitalizations from Omicron. So we hope that statistic holds. Just real quickly, some vaccine updates related to COVID to let you know where our area stands. The state of Georgia is currently 53% fully vaccinated, with 61% of people in Georgia having at least one dose of vaccine. In our Lawrence County area, we're not quite as well off here. We have about 44% fully vaccinated and 49% with at least one dose currently. This number's up. When we started our Delta wave, we were only at 31% vaccinated in our state. Delta rightfully scared a lot of people, and we had a pretty good uptick in our vaccination rate. And we still have, about 5% of the population with only one shot and catching up. And we're still encouraging folks to vaccinate as the best protection from disease. This is just a map that lets you know a little bit about vaccine density in the state of Georgia. The darker the color blue, the more vaccines are there based on 100,000 residents. The rate there. This is, of course, Lawrence County and approximation of Dublin because I added the dot. But if you can see, there are lots of areas of the state that are fairly dark blue, primarily Augusta and associated areas, some of the lake areas, metro Atlanta areas. And then I always say the Albany district stands out because they got scared to death early on and have really taken up the vaccine well. But the lighter blue areas of the state incorporate my 10-county district and then a big part of Waycross district and the Valdosta district. But again, Lawrence County is not as light as some of the counties. Wheeler County is one of my counties, and I always have to remind my state peers that even though it's one of the lightest shades of blue, about 2,500 of their 7,500 citizens are in an incarcerated facility that doesn't have a great vaccination rate, so it really throws their statistics off. But for the most part, we're stepping up and doing better, and hopefully we'll continue to see better and better rates. And then just to kind of let you know where we stand as a state, Georgia's vaccine totals lag national averages tremendously, particularly in pediatric data. And again, this is single dose data, and I know that children were approved later for the vaccine. But if you just look at single shots only in the whole state of Georgia, only 13.5% of kids aged 5 to 9 have this vaccine. Only about 35% that are ages 10 to 14, and a little more than half of teenagers 15 to 19, but that's in the state. Unfortunately, in our area and in South Georgia, these numbers are dismally lower. And probably for kids ages 5 to 9, we're at probably 2%. Kids ages 10 to 14, maybe 15%, and maybe, if we're lucky, 20% of kids 15 to 19 with just one shot. So, jokingly, I say, unlike in college football, Georgia remains the 6th lowest state for fully vaccinated individuals with an overall vaccination rate of 53%. So we're 6th from the bottom, but we're ahead of states like Mississippi and South Carolina and those kinds of things. But rural South Georgia has vaccination statistics that are some of the lowest in the United States. So, everybody's kind of resting on their laurels that Omicron is not as bad. One of the things I try to tell people is the story would be totally different if Omicron was just as virulent as Delta, because it's 3 to 4 times as infectious, but luckily doesn't seem to be affecting people as severely. But just imagine what things could be like if it was a repeat of Delta, but 3 or 4 times as infectious. And I try to use that as an encouragement for people to consider vaccinating. This is the topic I really didn't want to present, and this week while I was getting ready, it kept changing. So I'm going to kind of give just some really core basics on isolation and quarantine updates. I tried to make this look good, and it's just confusing still. But for people who test positive, those are the people who isolate. And if you test positive, it depends on whether or not you're symptomatic or asymptomatic as far as what you do. But basically, people who test positive now have to isolate in their home for 5 days, and preferably away from other family members as well to protect your family. And then if you're symptomatic and at least 5 days have passed since your symptoms started, you don't have fever for 24 hours and you're don't have any new symptoms, and after the 5 days, you can return to work or leave your home quarantine, but you're still expected to wear a mask for day 6 through 10. So that's based on statistics that about 90% of the population is most infectious 2 days before symptom onset and for about 3 days afterwards. So they're using a 5-day cutoff and saying that after the 5 days your rate of infectivity to other people is low enough that if you will wear the mask and still follow social distancing, that you should be safe as long as you're not having fever and symptoms. And basically asymptomatic people would do the same thing, but if you don't have symptoms, obviously you just follow the 5-day rule. It does say that if you later develop symptoms after testing positive, if you were an asymptomatic positive person who tested, you need to, if you develop symptoms, you need to consider that symptom onset date your day 0 and start to count from there. Some people do test early just because they were exposed and are concerned about risk. Quarantine guidance, quarantine is what we do if we're exposed but not positive. So quarantine guidance says an exposed person or close contact shall immediately quarantine at home unless they are fully vaccinated and received a timely booster dose when they're eligible. So if you're either fully vaccinated with 2 doses and it's not time for your booster yet, or if you've had both doses and have received a booster, then you're considered fully vaccinated. And if you're just exposed, you don't have to quarantine at home, but it is recommended that you wear a mask for 10 days to minimize your risk of spreading it to other people. And of course, if you develop symptoms, then you should follow the isolation guidance. If you're an exposed person and you develop symptoms, the likelihood of those symptoms being real is much more important. So you get tested and follow isolation guidance. But those who are not fully vaccinated, and actually those who are due a booster but haven't gotten it yet, if those folks are exposed, they're supposed to quarantine at home for 5 days from the date of last exposure, and then follow isolation guidance if they get symptoms, go home and get tested. So again, it speaks to the importance of your booster. They're finding that Omicron has a breakthrough rate fairly high in breaking through the vaccination. And so getting your booster is incredibly important if the time is here. I don't know if it's official. I think this week sometime they're going to decrease Pfizer's booster date to 5 months. So when that's official, we'll try to get as much information as we can, but watch for that and try to stay boosted to protect yourself against this variant particularly, and hopefully other variants as well. I did want to mention some quarantine exceptions that just came out in the new administrative order, because that'll affect some people in the room. But right now, exposed healthcare workers, exposed EMS workers, exposed first responders, exposed critical infrastructure workers, and now exposed educators and education staff, regardless of their vaccine status and where their exposure occurred, they can continue to work if they're asymptomatic, wear a mask while on duty, and comply with all other quarantine duties outside of work. So because those people are considered critical, if they're just exposed but not showing symptoms, they can continue to work with a mask until the time that they develop symptoms, or until they complete 10 days with a mask and can come out of the mask. But again, this is in the order, kind of a last resort to prevent cessation of operation of a facility. So those facilities that have to operate for food processing reasons, or again, healthcare facilities, EMS services, and first responder services, and now schools have been brought in under this rule. So I just wanted to make people aware, because I'm sure you'll hear a lot of back and forth about it. But we want very badly for schools not to be closed if we can help it. Just real quickly, moving away from COVID, and I'll try to rush along, but I wanted to give a quick flu update as well. I wanted to mention that flu this year is worse than last year. Last year we didn't even really have a flu season based on statistics in Georgia, but it's looking worse this year than last. The flu shot that is out, that's not the right one, is not working as well this year as last year. It's an educated guess as to which variants of the flu they developed flu shots against, so we're having more breakthrough with the flu shot this year. But the important thing too is that all flu shots this year are quadrivalent, so every flu shot option that you have protects it against 4 strains of the flu, so the shots overall have improved. But even though the flu shot's not working as well, I'm kind of ahead of myself. These are the data for the last few years with flu, but the red course here is this year's flu data, again, up until about Christmas. So I'll get a report this week that catches up for 2 weeks. But you can see that back in 2017-18, we had a really big flu spike. Last year, which is this year, we never even got above baseline rates. But this year we've crossed over and are kind of following a similar trend to some of these bigger curves. So be aware that flu Rona now exists as well, and you've heard about it some, but there are people who are getting both flu and COVID. The nice thing is the things you do to protect yourself from COVID are a really nice protection against flu as well. So again, the more we follow that guidance, the better off we'll be as a community and keep our community and our families safe. But again, despite the fact that the flu shot's not working as well by statistics, everyone still needs a flu shot this year. Nobody wants both influenza and COVID. We don't need 2 pandemics. Our hospitals don't need 2 outbreaks. So you can get your flu shots through our health departments in each of our 10 counties. You can get them at pharmacies. You can get them through your personal physicians or urgent care. And just remember that some protection is better than no protection. So just because you're hearing that the flu shot's not quite as good is not a reason not to get it. And just to answer a question I've heard a lot, and there may be other questions, but yes, you can get your flu shot and your COVID vaccine at the same time. CDC says that's okay. A lot of people have done that in our area and all over the country, so it's safe to do. I actually got my flu shot about 2 weeks before my COVID booster, but that was before before this wave of Omicron. In the heat of it, if you haven't gotten one or both, I would encourage people to get them at the same time, because your risk of putting things off for 2 weeks greatly increases your risk of getting one or the other. And then lastly, I just wanted to mention health and well-being, because that's a big part of what public health does when we're not so wrapped up in a pandemic. And just remember, an ounce of prevention is always important. Oh, well, getting carried away. So despite COVID-19, preventative medicine remains just as important as ever. So I encourage people not to get stuck on flu and COVID and forget about things like routine physicals. And importantly, don't avoid hospitals for needed acute care. Real early on in the pandemic, more so, people were scared to go to the hospital because they thought, that's where COVID exists. That's not where COVID exists. It exists everywhere in our community, and probably hospitals are some of our safest environments to go to. So you should never let the fear of contracting COVID keep you from going to the ER for chest pain or for acute shortness of breath or acute belly pain and all those things that make us normally go to the hospital. So, take care of yourself as you normally would with routine physicals, appropriate hospital visits. Think about things like routine dental care. Dentist offices are open back up and they're taking all the precautions that you can take. It's important to keep those things up. Don't forget about your cancer screenings, particularly pap smears, mammograms, PSAs, and colonoscopies. One of the things that's come out of the pandemic is people have put this off, and so statistics are showing worse cases of these cancers because people put off early detection measures. So really keep up with that. Do things like improve your diet and include fruits, vegetables, whole and organic foods, and avoid unnecessary sugars and sugary drinks. Doing those basic things to take care of yourself as far as diet and exercise help you be healthier overall. And better health gives a better workforce and just a better community in general. Start a regular exercise routine, and other things that are important are stress reduction. So those are just some basic things I wanted to mention outside of COVID. Don't let COVID overwhelm your health, and take better care of yourself overall. And then if I have time, just take maybe 2 questions from the audience. And that may even save you a lot. Well, there's one.
You still vaccinate over at mall area?
We currently, again, we try to do things based on demand, and we have to make good use of our resources and the state money that we're given to, so we were doing 2 days a week at the Dollar General site on the back of the mall, but demand has fallen off for vaccines again. So that's now Wednesdays from 8:30 till 4 every day. There's a just quick drive-up site. You walk in, get your shot, walk out. It's the quickest way in town to get the vaccine without a lot of other runaround. Still free vaccine. And our health departments are also giving them daily as well. Most of my smaller counties are trying to pick one major day of the week to give them, but they'll give them at the health department any day you walk up, anytime. Yes?
Do you think there will come a time when the flu and the COVID vaccine are combined in the same needle?
There are actually companies working on that now. I don't think one's been released, but I'm sure you probably will see that. And my hope is, I think everybody's hope is, that as COVID works its way through the world population and we develop progressive herd immunity and natural immunity on our own, in addition to protection from vaccination, that you'll see this become a very flu-like disease with time. And you'll probably wind up getting, a combined booster if you want to, but hopefully down the road, the at-risk populations will be the ones primarily getting COVID vaccine, just like they get flu vaccine every year, and can get it in combined form as well.
I want to say thank you, Jennifer, for sponsoring with Oconee EMC this morning for our breakfast. I also want to say thank you to the folks that are here from Rotary this morning. We got a good crowd from Rotary that joined us this morning, so thank you to our Rotary folks and Brian for bringing those folks this morning. Do want to announce the Irish Chamber Breakfast. We are having the Irish Chamber Breakfast this year. We're glad there's a lot of great events that are planned this year for the month of March, and that will be on the 15th. It'll be on March 15th. If you want to put that on your calendars, I want to say a big thank you to the folks at Morris Bank for continuing to sponsor that program, and there will be some more details to follow on that. David's going to hang around if you're interested at all. If you don't have vision care, again, no cost to you as a chamber member. The plan that they're providing is included in your chamber membership. David and I work together on this. And so just an example, if you need an eye exam, instead of paying $100, you can get it for $69. There's some great savings in this plan. So if you want to see David about that, and I hope maybe Dr. Kraft, and I see Don had to slip out, but Lindsay's here, or I'm sorry, Elizabeth. If you have a question maybe about the hospital or something, if you want to ask one of them, they'll be glad to help you with that. And I do also want to say thank you to everyone that's registered. We have a sold out annual dinner, January 28th, and we've got our award winners already for that, and it's going to be a great night. And somebody is going to win $500 cash that night in the run for the Shamrock. So it's going to be an exciting night, and we hope you're already planning to join us for that. And with that, we're going to close our program. I think I covered everything. So it's a great day for business in Dublin and Lawrence County. We are adjourned.